Hi, it's Dr. Crystal Maxwell, and thank you for joining me. I look forward to sharing some information with you today about hair thinning and hair loss after you've lost weight. So tune in. I think you're going to get some really great tips to help. So it is possible for you to regain your hair and your inner confidence. And we are going to go from thinning worries to building your everyday confidence. So I welcome you as your journey begins, because I really want you to know that you are not alone in what you have been experiencing since losing weight and then beginning to have hair thinning, hair loss. So this video is a safe space for you to get some clarity and support in what you're experiencing. We're going to walk through this together. So I want to give you a little bit about my why. Why am I even providing the service and talking about it? I had a patient who lost weight successfully and she was very excited, but she began to experience hair thinning. I saw her use a lot of different products. She underwent some procedures to her scalp that involved injections that was painful. She spent a lot of money on those products. Once I brought in a non-invasive option for her, she began doing those treatments and her hair began to regrow. It wasn't painful when she experienced it. And she found relief in that she was continuing to keep her weight off as we were working on her weight loss and maintaining, but her hair was growing back and she felt better about her body as a whole. And that helped me to really capture the essence of why I brought the machine in, was to help people exactly like her. So why is it that you are experiencing hair thinning, hair loss in the first place? Let's walk through those steps. This is the hair growth cycle. There are 4 phases. There's the anagen phase, which is the growth phase that lasts about 2 to 7 years. There's the catagen phase, which is considered a transition phase, and it lasts about 2 to 3 weeks. Then there's the telogen phase, which is when your hair goes into a resting phase, and that typically lasts about 3 to 4 months. And then you have the exogen phase, which is considered the shedding phase. And as you notice in the first phase, anagen, the root of that hair follicle goes all the way down to the base, and there is a connection to the blood supply there. But when you get to the catagen phase, that transition phase, there's a release. And as you continue through the phases, that's where the hair is detached and begins to do shedding. So this can be affected by stress, that you begin losing more hair going through the telogen to exogen phase. Nutritional shifts after weight loss can also affect that. There can be medications that affect how your hair proceeds through the hair growth cycle. GLP-1 medications might indirectly affect hair growth cycles because you are eating less. And so some of the nutrients that you would normally be taking in, you may still not be getting enough of it from what you are eating, even if you are eating healthy. And then just understanding exactly what's going on can help you. So seeing this growth cycle, seeing what things are happening to you and understanding what's happening to you can help you to understand what's happening to your own growth cycle. And it can help to release some of the shame and guilt that you may be experiencing by understanding these effects that you are experiencing. Here's another example that I like to share of another patient of mine who, again, she was experiencing weight loss, was really happy, but began noticing more hair in her hairbrush. And when she washed her hair, it was coming out in a lot more clumps. And we talked about the non-invasive procedure that I offer and walked her through that, and that made sense to her. So fortunately, unlike the other client that I had, she didn't spend a whole lot of money. She hadn't spent a whole lot of money on products or other procedures. She was able to just transition into doing the non-invasive options, and her shedding began to decrease over the next few months. And then she started noticing even more thickening and hair growth of her hair. And she's been very happy to experience that. So when we discuss new approaches to hair restoration, there are some options that are not painful and are not invasive. The Alma-TED supports hair scalp health, and it can restore your confidence without having to use needles or downtime. It actually uses ultrasound waves instead of needles to stimulate the scalp. As you can see in the picture here, there's use of a steel metal that transmits the ultrasound, so you feel a vibration sensation. It's stimulating the scalp for circulation. And then we apply a protein serum to your scalp to stimulate that growth. So recovery is possible. Here are some examples of people who've used the TED treatments to help stimulate their hair growth. One of the big positives about using the TED is with the serum protein, it's not dependent on your health the way that PRP injections that you may have heard of do. PRP injections are where you take your plasma and you take a blood draw, take that plasma out, and then re-inject it into yourself to help stimulate your hair to regrow. But if you're not healthy on certain medications and don't have rich plasma, then you may not experience good results. Using a specially formulated protein serum that takes away that variability is why we can see results like these clients have had. And it's good on all ethnicities of hair, men and women as well. And so it can help to promote and stimulate that hair growth. So what you can do now to help yourself as you're experiencing hair thinning and hair loss is think about things differently. You may have seen a lot of things or tried things that haven't worked, but there are some other options that you should consider. Let's explore the non-invasive option. It's not painful. I've had people to fall asleep while they're actually getting the procedure, and I have to wake them up and say, hey, we're done. And let's explore that option. And the first step of doing that is just us having a conversation about what that could look like for you. So schedule a consultation with me. You deserve to feel whole and not just healthier. Even though you've lost weight and your metabolic numbers may be looking better, your hemoglobin A1C, cholesterol, those things may be better. You may not be feeling your best self because you're concerned about your hair thinning and hair loss. So this is an important thing for you that you do deserve because your hair does matter. It does affect how you feel about yourself. Let's talk about how a TED or just in general, what may be going on with your hair. Is TED right for you? Can it help to get you back on track? I'm here to help walk you through it. If it's appropriate for you, we'll talk about that. If it's not, I'll let you know, and then we can talk about what other options may be more suitable for you. But I encourage you, schedule a consultation. I love to see you. I love to help you get back on track. You've lost weight. You deserve to feel good from your hair to your toes.